Good afternoon, everyone. Welcome to today's webinar hosted by National VOAD, Adapting to COVID-19 Voluntary Organization Best Practices. My name is Catherine Boatwright. I'm the Director of Operations for National VOAD. We are so thrilled that you're here with us today. As you all know, we are in really challenging times, trying to continue to deliver services and operate within a pandemic under COVID-19. So today we've created a panel for you all to talk about what they're doing, how they've adapted their services, and just to get the conversation going about how we can all continue to operate or maybe scale back in some ways or just adapt to our current environment. So you're going to be hearing from 5 amazing speakers today to hear what they're doing. But before we get started, I'll turn it over to Greg Forrester, President and CEO of National VOAD, for a few comments.
Good afternoon, everybody, or evening, depending on where you're at within our timelines out there. I just want to thank you for taking the time as we discuss how do we operate in this new environment. I know as I've participated in a number of phone calls with the press these last couple of days, they're asking that same question. How will we as National VOAD, as the voluntary sector, provide services in the disaster zones that are sure to show up in the coming weeks? And so I let them know that we're preparing, we're having the conversations, we're having the dialogue that's necessary. And so as we go through today, I want you to keep an open mind, ask lots of questions, and believing that we don't have all the answers just yet, but that together we can explore how we find solutions. I also want to thank Team Rubicon for leading in to this webinar for us and really providing the backbone to make this happen this afternoon. So with that, Catherine, I turn them back over to you.
Thank you, Greg. So part of our mission is to provide a forum for promoting the 4 C's: cooperation, communication, coordination, collaboration. And when resources are stretched, that is our bread and butter. That is how we go the extra mile to deliver the necessary services. And right now we are in those times. And the challenges that we're facing today are unprecedented. So I also want to put out a caveat that you're going to hear from 5 different organizations and how they are adapting. That may or may not work for your organization and your context, and that's okay. Today is a conversation. We're going to listen, we're going to learn, we're going to share ideas, and this conversation will continue. We've only been at this a few weeks. So what we call best practices are, they've been tested, but not for that long, right? So we want to go into this with an open mind and also know that we've got a lot to learn still, but I know that we've been doing this for a long time and we'll continue to do this for a long time. And so today is a way that we can help each other out in that and build those partnerships. I want to thank all of our panelists for being here today. It's very busy times and they didn't need to be here, but they are for the sake of partnership. So we're really excited to have them. Before I introduce them, I do want to tell you that we're going to be putting a poll out that we'd love to get your input on what is the single greatest challenge to voluntary organizations right now. We've narrowed it down to 5 areas and we'd love to hear what you have to say about that. Is it funding? Is it volunteer availability? Is it PPE? Or is it adapting your procedures and services? You'll see that pop on your screen here in a second, and please fill that out as you're listening to our panelists. So today who we have with us is Anthony Placino from St. Vincent de Paul Disaster Services, Brad Kaiserman from American Red Cross, David Burke from Team Rubicon, Patrick Crawford from Feeding America, and Kevin King from Mennonite Disaster Service. Thank you all for being here today. I'm going to go ahead and let each of you introduce yourselves and talk about what your individual agency is doing in light of COVID-19, how you've adapted, how you're using volunteers or maybe not. We just love to hear what your current posture is in this environment. And we'll go ahead and start out with David Burke from Team Rubicon.
Thank you, Catherine. And thank you all for being here today. It's an incredible turnout to see about 625 attendees right now. So thanks everyone from our National VOAD partners, from our governmental partners, from the private sector that I know are joining. This is a publicly open forum, so thanks for everyone in attendance. Kind of to frame a little bit about what Team Rubicon's done in the backdrop of COVID-19, we all have to recognize and realize that COVID-19 is the most complex crisis that we have faced in our lifetime and likely that we will face. Maybe that's hopeful, but that's part of the reality that we're operating in today. And it's going to require partnership with all of the organizations, agencies, governmental, non-governmental, social services, and private sector to really take the fight to this virus and make sure that we're doing all that we can, not just as a VOAD movement, but as partners in a whole of America response. Team Rubicon immediately shifted our whole organization into a response posture. As soon as COVID-19 began to move across the country, we switched to a work from home posture early, and we rearranged the organization to ensure that we could look at this problem set and opportunity space to ensure we're doing the best that we can in the backdrop of COVID-19 by focusing our teams purely on COVID-19. We focused on safety and informed consent for our volunteer base to ensure that they knew exactly what they were accepting as individuals. And we made sure that we were able to respond to communities, both to our traditional hazards and our core operations, but also make sure that we weren't missing opportunities to support community needs that Team Rubicon has never stepped into before. That's resulted in incredible partnerships and different relationships than we expected to have. Those range from forming and kind of a norming partnership with Feeding America to support food banks and pantries across the country with a volunteer base that is able to help in places where volunteers have become limited across the country. And that's made sure that some of the food security issues that we're seeing can be mitigated and limited through a new use of Team Rubicon volunteers, a place that we didn't expect to be, but we're happy just to support any agency that is seeing a shortfall. So that's been an incredible change for the organization. In addition to things like feeding support, we've jumped into mobile testing, supporting communities across the country, specifically getting test sites up in North Carolina to make sure that individuals that are experiencing symptoms can go through the appropriate processes and get their tests resolved as quickly as possible. We're working with the Health and Human Services to staff federal medical stations and applying medical volunteers. It's typically a Team Rubicon international response only in a domestic setting. So that's been an interesting expansion of the organization's capabilities. And really we're shifting to make sure the organization can get to yes wherever possible. And that has required new partnerships across the space. We're working more closely with governmental, non-governmental, VOAD partners in the private sector than we have in any instance before, or at least at a higher volume. So what we've committed to do as a team is to hold true to our mission. We're delivering services both in the disaster response space, but also in humanitarian needs that we may not see ever again in this country without the backdrop of this virus. We will continue to work to exhaust all resources available to Team Rubicon to support needs where they arise. And we'll only have a good understanding where those needs are and how we can all partner together if this group, the National VOAD, and all of our governmental partners are really talking about what the needs are and communicating where they are so that we can build plans to respond. I think the big takeaway for Team Rubicon and for hopefully, this group, and hopefully this will be reinforced throughout, is this movement, this community can enable a better response to COVID-19, result in fewer people suffering and a lower loss of life across the country if we continue to work together and drive the 4 C's and make sure we're delivering on all of our commitments as partners across the VOAD space. Catherine, I'll pass it back and we can keep moving.
Thanks, David. I appreciate that so much, and how you all have shifted in pretty major ways pretty quickly. I'll go ahead and turn to Kevin King from Mennonite Disaster Services.
Yes, good afternoon. Thank you, Catherine. As Executive Director for Mennonite Disaster Service, certainly it's been a huge shift for us. We had 16 projects going on in the rebuilding efforts throughout the U.S. and Canada. And so by adopting social distancing practices, it meant we had to close it down and all the volunteers returned home. That was the challenge. But never wanting to waste a crisis, we saw an opportunity. Here we had people sitting at home, sheltering in place, or if they would volunteer, it would be done in a manner of single deployment or operate in some kind of fashion with less than 10 people with a safe distance. This really impacted a specific group of our constituents, the plain people, the Amish, or Mennonite. For example, in eastern Ohio, over 2,200 cabinet making and woodworking small businesses closed down. So they cleaned out their floors, and the women, their wives, brought in the sewing machines and started making thousands of cloth face masks a day. You have Amish harness shops utilizing their equipment to cut the fabric and sew it as well. Kits of 25 with all the material and instructions are being put in a gallon bag, dropped off at the front porch of those who want to sew within their own living room. Next day, a driver swings by, drops off another kit, picks up the completed masks. It's important to note that the cloth face masks that we're making in each community, whether it's eastern Ohio or Shenandoah Valley of Virginia or Lancaster County, each of those are in strong conversations with the local hospital network. Specifications, the level 1, level 3. So it's been quite engaging. They're at the point, I think they're making about 50,000 of these per day, cloth face masks. So it's been it's also been a mental health issue. Here you have people sitting at home, not able to do something, and now they can work with their hands. So it's been a great, you might say, a release for our people. They can't swing a hammer, then their wives will come in and well, the men are involved too, no doubt about it. I think for us, for Mennonite Disaster Service, it's an opportunity also for organizations to reach out locally, even as we're doing. Normally not in our operations plans. We're talking with the United Ways, we're talking with Office of Aging, food banks, ministeriums, child care centers, hospitals, Meals on Wheels, EMTs, fire stations. Anyways, this virus knows no boundaries, but the generosity and willingness of people to collaborate, truly, truly astounding. Catherine, I'll leave it for that, but that's one small way.
Thank you. I would say that going from building roofs to using a sewing machine is a big shift, so I appreciate your flexibility in these days. Okay, let's go to Brad Kaiserman, American Red Cross.
Thank you, Catherine, and thanks to all of our colleagues, both those who are speaking and those who were in attendance, and thanks to NVOAD for putting this together. We became aware of COVID right around New Year's Eve. We were tracking some of the information coming out of Johns Hopkins. I agree with David. I think at that point, some of us recognized that this could be a generation, if not species, shifting event. Getting everyone else or other people on board with that was probably one of the biggest challenges early on. I think that folks were, what are you talking about, Corona? Isn't that a beer? What's that all about? So I think it took a while for people to understand and appreciate both the complexity that David referred to and the extent of impact that COVID is having and will have. I had a chance, probably the first chance I've had in 3 months to sit back for about 10 minutes today and think. And if I think on it, I guess a couple things come to mind. First of all, I think for the Red Cross, COVID is not going to change the mission we do. It may change the way we do the mission. And I think that's an important distinction. It would be easy to abandon the notion that we have to prevent and alleviate human suffering, that we have some other mission that we need to do right now, or we have to back away from the mission because there are dangers involved. But I think the first thing for us was committing that it's not going to change the mission we do. So then it became an issue of how is it going to change the way we do the mission? It is ironic, isn't it, that perhaps the thing that will ultimately bring humanity together or serve as a unifying function requires us all to stay 6 feet apart. I've been I've been thinking about that for several days now. And the reason I mention it is if I think about the single most dramatic shift that I see COVID driving, it's the fact that most of our organizations, many of our organizations, fundamentally depend on close person-to-person contact. Whether I look at what Kevin does, what David does, and I look at the many, many organizations that are represented on the call today, what most of us do is close person-to-person contact. My boss, Gail McGovern, always says, it's a hug. It's the volunteer giving that person a hug that makes the difference. And we can't do that now. So what's the virtual hug look like? How are we going to make that difference when we have to stay at least 6 feet apart and maybe even further? And to me, that, while it seems simple, that is the defining characteristic of our services going forward, is how can we maintain distance while still bringing people together? So some of the challenges that we've faced and that we've responded to is, first, we had to agree on some mission essential functions. You can't do everything. The Red Cross, as you all know, has 3 major legs upon which it stands. One is biomedical and blood. And at the very beginning of this crisis, and I think even now for the Red Cross as an enterprise, blood services is our top priority. Maintaining the nation's supply of life-sustaining and life-saving blood is critical. And you could imagine that, man, what requires people to be closer together than having a phlebotomist put a needle in your arm? And yet, our partners in government, our partners across the volunteer organizations have been fantastic, including the Surgeon General, in saying how important it is for people to continue giving blood and plasma. And as a result of that, our blood supply remains green. People are still coming in a way that allows us to sustain the blood supply. Now, our biomedical team, they've had to get ahead of the curve on personal protective equipment, on all of the management of social distancing, of screening at the door, many of the same things that we're all having to do in mass care and congregate sheltering. And then our folks who do training, whether it's breathing training, swimming training, babysitting training, all the very emergency medical training that folks do, all of that up till now has required close personal contact. And so they're finding ways to deliver training virtually to the greatest extent possible. So there's those across our 3 lines of our major lines of business: humanitarian services, training, and biomedical. We've really had to deal with that person-to-person contact deficit that COVID causes. From a disaster response perspective, we began with the Red Cross responding to COVID by supporting HHS, CDC, and State Department repatriations, beginning from China. And so that was everything from providing comfort kits and cots and blankets in places to providing some financial assistance and casework to expatriates who were coming out of repatriation and hadn't been in the United States in years. They had no home here, no place to go, no source of funds. They'd be confined for 14 days. So that work was really the bulk of February and going into March. At some point, repatriation and quarantine no longer became practical. That was followed by a lot, and continues with a lot, of local quarantine support. So as local governments were beginning to stand up quarantine or medical facilities, there was an immediate demand for cots and blankets, comfort kits, other medical supplies, all of which we maintain an inventory for disaster, and so we were able to support many of those requests. Then came feeding requests. So everything from a large operation with the Los Angeles Unified School District to smaller operations around the country, first feeding children and helping to feed children who were not in school, and really just a distribution mission, whether it was driving around or whether it was going at fixed sites, but all of that done with a social distancing mechanism. Put the prepackaged meal on a table, step back, car drives by, they pick up the meals, and when the table's clear, stop the cars, put meals back, keep going, right? So how do you keep that mission going without close person-to-person contact? And of course, disasters don't stop for COVID, and they won't. We just saw the Colorado State University forecast for an above-average hurricane season, and not just for formation, but also for landfall in the Atlantic Basin. So we collectively need to be preparing for a major hurricane season in the face of COVID. And of course, we don't have to wait for hurricane season. We had the tornadoes in Nashville, that EF4 killed 26 people. Those two tornadoes all happened right as this was spinning up. And so we were having folks who were positive for COVID. We had to work that in the shelter population, work with public health to set up isolation, and very rapidly develop a sheltering protocol that we would be able to use to sustain going forward. And quite honestly, in the absence of some sort of developed immunity or pharmaceutical intervention, this is our world for the foreseeable future. It may go up and down as a roller coaster, and maybe the curves, maybe those peaks get a little flatter as we get better at social distancing and perhaps other interventions become apparent. But from our perspective, we're planning for the long term here, and the protocols we're establishing and building now with each other for how we do mass care and congregate sheltering and feeding, those are probably what we're going to live with here every day for the next couple of years. We had the Utah earthquakes in Salt Lake City. So it became at that point, how do we find non-congregate solutions, hotels, motels, Airbnb, instead of trying to put people into congregate? And that works fine if you have 100 people who need shelter for a couple of nights. Maybe works fine if you've got 200 people. Probably works okay for the many multifamily fires we've responded to in the last 60 days, where New York City, where you've got 187 people pouring out of an apartment building. Well, there's space in New York City. There are hotel rooms and motel rooms. They're still open for business for the most part. That's not going to work in every community in the country. So as much as I'd like to say that we're going to do everything we can with our partners to find non-congregate solutions, I think we collectively have to plan for congregate. And that's where we're going to be at some point here with a major hurricane, major wildfire, or major earthquake, which seems inevitable given the pace of disasters over the last 5 years. So we've been actively developing protocols and testing those and exercising them, both in terms of real responses that we've been doing and the ones we're preparing for as we get closer to spring floods and hurricanes. And then finally, there are a series of what I'd call utilizing the capability and capacity we have, but delivering a slightly different mission. So I talked about the feeding missions. We're working and developing a mission now to support condolence care in around the country, and we're also looking at options to support health workers. So we've got a couple of pilot operations going on around the country, but healthcare workers, I just have such incredible need right now. Everything from Habitat for Humanity's got a great program to help set up apartments for healthcare workers in New York and some of our other harder hit places, trying to support our partners in those programs. And there just seems to be an array of need. Biggest challenge I see, really is understanding need. It's one thing for us to surmise what need is, but I think each community is at a different phase in its response to COVID. And as you know, the various curves for COVID are different depending on when it hit your community, where it hit, how bad it hit. So while it looks like the United States on average is going to peak sometime next week, knock wood, every community in the country is not going to peak sometime next week. Some communities aren't forecast to peak until late May. So the fact that everybody's in a different movie, so to speak, and how do you synchronize that work so that there's equitable service to all folks who need help, and that we're being able to provide consistent service everywhere. So it's understanding that need and being able to match the need in many various circumstances around the country. I think that's one of the biggest challenges we face right now. Very grateful for all of our partners and for this opportunity that you all have provided today. I know this will lay the foundation for some of the very difficult challenges that face us in the coming months. Thank you, Catherine.
Thank you, Brad. I appreciate all of that. And, you've alluded to what I think keeps us up at night is that Category 3 to slam, 6 states on the coast and what we do then. So thank you for that. Okay, I would love to go to the phone. Patrick Crawford from Feeding America.
Hey, Catherine, can you hear me?
We can. Go ahead, sir.
Hey, thanks for putting this on. I think this is really helpful, the information that's been shared already, and I expect those others that will chime in as we go along. Couple thoughts as we think about what our country is facing. I wouldn't say that our network of food banks is doing anything different in terms of core mission. It's just the same thing. It's just on a whole different scale and with a slightly different approach. David mentioned that that Team Rubicon canceled travel or put a halt to travel and instituted remote working early. We did as well for our national office, but obviously member food banks are not able to remote work, and they've also been designated as essential organizations, and therefore not subject to local or statewide, physical distancing orders that are in place. There have been numerous new partnerships, but in particular, I just wanted to call out and thank the deepening of relationships and partnerships with the VOAD community, or rather new takes on it. David mentioned the norming and forming process that we've been engaging with Team Rubicon, but we've had wonderful offers of support from the networks of Send Relief and the Adventist Community Services and so many others. So I'm very grateful for this community and for the role that National VOAD plays in kind of getting the word out and helping us all stay connected. In terms of the impacts of COVID, it really has shifted how food banks operate. So much of what donations, it's shifted how donations are accessed. It's shifted how services are delivered and how staff and volunteers are able to engage. And recent weeks are retailing and manufacturing food donations have declined significantly, 40 to 60%, while at the same time the community needs have increased significantly. We've been doing these pulse surveys of our network to really kind of capture snapshots in time, and in some cases, if there's something timely in a particular week or couple-week period of time, we incorporate those. And the recent pulse survey that we conducted of our network indicated that 95% of food banks were reporting an average of 40% increase in the number of people that are turning to them. It probably could be changing every day. Obviously, we are experiencing the largest increase in the number of people filing unemployment claims in our country's history. Unlike anything we've ever seen with the recent recession, the Great Recession, and as you can imagine, that's translated into more and more people turning to food banks and local emergency food providers for assistance, people that would never have had to do that in the past. Based on the decreased food donations and the increased demand, our food banks are seeing a daily food depletion rate in the range of 2 to 6 million pounds of food a day. Compounding the inventory shortages and volunteer shortages created by the health safety measures, our network has had to re-engineer how to distribute food into the community, since many of the food pantries, that last mile. So our 200 food banks support 60,000 local community-based organizations that are, the food pantries, programs that are focused on feeding children or seniors. And those programs, those local organizations are largely volunteer run, and many of them aren't able to stay open. And so it's resulted in food banks really doing a lot more direct distribution. That was always a part of the overall strategy, and now it's front and center as kind of one of the main channels for getting food into the community. So direct distributions that are no or low contact, are obviously allowing people to keep the proper distance from one another. Volunteer shortages at the local level have been difficult. Also, some of the volunteer groups are canceling the mainstays, but in many instances, food banks are able to address volunteer issues through National Guard troops that have been assigned to work at food banks, state employees, non-essential state employees that have been encouraged or asked to work at food banks. So in some cases, it's not accessing volunteers. It's really the social distancing that makes things different and difficult. I was speaking to the food bank in Oklahoma City the other day, and they normally run 300 some volunteers through their operation, and because of the social distancing and shift changes and the like, they really can only handle 30 volunteers a day. So it's really adjusting how they're having to operate. There is some good news. We've had some success with some federal appropriations that promise help on the way. Food banks, although not all food banks, a lot of our network receives USDA commodities called TFAP, the Emergency Food Assistance Program, and CSFP, which is targeted towards seniors, and a few other things. So those recent appropriations had new resources designated to USDA that eventually will make their way to food banks. In many instances, that's several months away. So I think that the Families First Coronavirus Response Act and the CARES Act will be really helpful. But we've got some gaps in the short term. We also had a really generous donation recently from Jeff Bezos with Amazon for $100 million. But I will tell you that the estimates from our team and looking at the next 6 months of maintaining operations and accounting for increased demand on those resources really put our next 6-month figure at about $1.4 billion. So I mention all this to say that it's changing the way we're doing operations. It's obviously at a different pace and a different scale, and we're just continually having to rethink how we're doing things so that we keep people safe, to keep employees safe, keep volunteers safe, and still are able to keep food flowing into communities. And the last thing I'll mention is that we are really having difficulty with some supply chain issues. Not in some cases, shelf-stable food is really difficult to get to. Our network regularly has, in addition to in-kind donations, streams of purchased food, so taking donated dollars and purchasing food. And some of the regular vendors that we work with have been canceling or delaying orders. Like many of you, our organization early on decided not to invest a lot of time and effort in trying to purchase PPE. Obviously, it was needed for medical professionals, and it just wasn't available for purchase. However, a number of our food banks through local connections have had some success in purchasing things, but increasingly in the last week or two, many of those orders have been canceled as it was prioritized for governmental purchases in other cases. So I'll stop there, and I know we need to get some of the other panelists in, and just thank you again for including us as a part of the discussion today.
Thank you so much, Patrick. The food banks are under enormous pressure right now, and we just appreciate all that you're doing. Okay, I will shift to Anthony Pluchino of St. Vincent de Paul Disaster Services. Are you on, Anthony? Anthony, can you hear me?
Hi, Catherine. We've been unable to get him on this call.
Okay. All right. Well, that's a shame. St. Vincent de Paul does tremendous work in case management and disaster case management, and they have shifted their entire operation virtually. So it's a tremendous lift for them, and just a unique service delivery model that they've deployed right now. So hopefully we can hear from them at another time. I do want to pose some questions to the panel specifically that have come up time and time again, and thank you all for those overview of what you're doing. Obviously, we all know that there are heightened risks for certain populations if you are immunocompromised or of a certain age, et cetera. How has this shifted how and if you use volunteers? Any specific communications or guidelines that you've implemented for your organization?
Hey, Catherine, it's Brad. I'm happy to take a run at that real quick. We began a screening process early on, which we, before we dispatched anyone on a disaster action team call to a home fire or a local event, or before we deployed anyone, for example, to Tennessee or to Salt Lake City for a larger event, where we worked them through on the phone one by one each of the risks associated with deployment or dispatch as identified by CDC. We also went through some screening questions that were recommended by CDC about temperature and contact and were you traveling abroad when that was a relevant question. And then at that point, we've asked folks, understanding the risks, do you want to accept the assignment? And some folks have said yes, and some folks have said no. And I think as many of the other panelists mentioned, being able to continue to engage folks virtually is just vitally important for many, many reasons, including just the fabric of community. And so for those volunteers who were not able to dispatch or deploy or did not want to accept that risk, we've tried to continue to find virtual options for them. And I can tell you, as we go to large-scale disaster responses like major hurricanes or disasters, we'll probably have about 70 to 80% of the support function that we would do operating virtually. There's no reason to create vectors or create that risk. So the 20 or 30% that we would normally send that will have to be on the ground, we're going to have to make sure they've got appropriate protection and training, and that we've structured their interactions with the public to mitigate that risk. So we're screening folks now. We've just reached out to 1,000 of our senior most volunteer managers who have in the past year deployed over and over again before COVID. And we've asked them whether or not they would be willing to accept a virtual deployment. And if they would be willing to accept a virtual deployment, do they have the equipment they need to operate? So I don't want to find out on August 25th when that first major hurricane makes landfall. By the way, that's not a prediction. When that happens, I don't want to find out that virtual seemed like a great idea, but everybody doesn't have a laptop and everybody doesn't have the right software, and some people don't have connectivity or don't have bandwidth. So we're really trying to, in the next several weeks, identify all of those unmet needs for certainly our volunteer leaders, and then have a strategy for meeting those needs now before point of need. So those are just some of the things we've been doing.
That's great. I love the idea of technology and connectivity being a action of preparedness.
Yeah, I'll jump in.
Hey, Catherine, it's Patrick Raw. Just to tip in, Brad and Red Cross were really helpful early on to our network, sharing some of those screening questions, and really helped us think about and work with our food bank network. And I would say that there are a variety of standards that food banks are using to assess volunteer eligibility, age, wellness and travel. Some have elected only to work with volunteers that are under 60 at this point, and excluding volunteers who have pre-existing conditions, diabetes, COPD, and immunosuppressed, et cetera, from group volunteer activities. Volunteer waivers have been revised to include some COVID language, and there's some new screening protocols that several of them are using, again, based on CDC guidance, which may include some phone screen before they arrive, and even health screening on site, in some cases taking temperature prior to volunteers entering the building. So some food banks are, as I mentioned, also just engaging entirely new groups, whether it's state employees or National Guard. So I think unlike in Blue Skies, where there are a lot of regular volunteers, not only is it important to be hypervigilant in this environment just with people's health concerns at play, but also we're just having a lot of new people who are new to volunteering at food bank in the mix. And so anyway, thank you to Red Cross and to Brad and April and everybody for sharing a lot of their early screening questions. It really informed a lot of our efforts as well.
That's great. David?
Yeah, I'll add a few elements. Brad gave a great overview of what I think the whole sector is doing, should be doing. A couple of the places that we've added, we've strengthened our virtual engagement of volunteers, both in the informed consent or waiver process, whichever language your organization uses, to ensure they know every risk that they're taking based on the actual activity, low interaction activity, moderate interaction with COVID symptomatic or confirmed, or direct interaction with COVID symptomatic and confirmed. to ensure that we have very clear understanding of the risk the individual is accepting and that they have the opt-out option. In addition to that, very early on, we set an age limit, which was not the most popular thing in the world, but the only way we could ensure that we were providing universal protection. We set it at 60, and we adjusted it to 64 when CDC released their guidance to match the CDC guidance, and we followed those procedures very carefully. One of the unique things that Team Rubicon was prepared for here was we have about 1,500 volunteer leaders that really are the heartbeat and staff of the organization across the whole country, and they engage in this environment always. They were actually coming back and teaching some of the staff that's used to an office how to engage in a virtual remote work from home environment. And so that's been a huge benefit to make sure the organization can continue. And we went activity by activity to identify what could be done remotely and successfully. Many of our volunteers that are generally coaching and mentoring volunteer leaders on the ground to support volunteers well, to interact with communities well, that coaching and mentoring happens to come from some of the age-restricted volunteers, and they're able to do that remotely. And so that's been a great benefit to make sure that we manage that remote engagement. We've shifted a ton of our training to a virtual design as well.
That's great. I'd love to hear some more practicalities about using volunteers in consideration of social distancing. So, I heard Brad, you mentioned like put the food box on the table, step away, let the car drive up. Any other just couple of pointers just to get some ideas flowing for some of the folks on the phone?
Sure. I mean, one of the things is obviously in a congregate shelter environment, the standard distance that you would put cots and people is going to change because that 6 square feet may not cover it anymore. So that drives a lot, right? If you're going to have to expand the amount of space that any individual or family is going to have in a congregate setting, it probably means you will be able to put fewer people into that space, which means you'll need more spaces, which means you need more shelters, which means you need more people, which makes it a little more dangerous because we really don't want to put more people down there collectively. That's not good for the community, not good for the workers. So more people means more personal protective equipment. And so that's another piece of this is where do you get the PPE from, especially when we're trying to preserve PPE for healthcare workers that desperately need it. And that has certainly been a challenge, I think, for everyone is how much inventory do you hold for the large events that are, in the next 90 days? How much do you distribute or share? What level of protection from a triage perspective do you provide? I 100% agree with David. It is a layered approach depending on the extent of contact and the degree of infection and the risk of the volunteer. So I think those are some of the very practical issues that we've been dealing with. And then there's honestly workforce compliance, if I can use that term. It's great for me to sit in my remote operations center room here in the mountains of Front Royal, Virginia, but I'm not the guy who's in the Bronx responding to that multifamily fire at 2:00 in the morning. And if that team of volunteers responding to that fire isn't getting the N95 and isn't getting the guidance and they're getting up close and personal, that's not good for anybody. That's not a sustainable outcome. So reaching to the edge, we used to call it power to the edge back in the day, but reaching to the edge of the organization and making sure that critical health and safety guidance gets there, whether it's through these virtual channels. We're really using every communications channel we can get to get to the folks who are doing the work, to make sure they understand the risk and understand the safety protocols, and that we're keeping up with them because they are changing, like David said, and they should be. As government learns more, we're getting different and better advice. So I think all of that has been some of the practical dimensions of just trying to manage that social distancing piece.
That's good. I think some takeaways is that it's complex, it's ever changing, and there's probably not a straightforward answer for everyone here. So that's probably the single greatest question we've received since COVID made its way here. I think one huge asset of the VOAD movement is that we identify gaps and someone jumps in to meet them. So I'd love to pose a question to you all on the phone. What are those critical gaps in services that you are seeing currently that aren't being addressed and that you think are going to be a real challenge in the coming weeks, months, et cetera?
I'm waiting to see who can jump in.
Yeah, go ahead.
The summary at the front end that Brad provided on complexity of need, community by community, peak by peak. If we as a community can commit to working hard together to identify where the next peak is and flow resources in, that's going to be a requirement to really support the communities as this virus transitions across the nation. And each community will have a different set of needs. You know, one, I'm very fortunate. I feel very fortunate that Patrick Crawford's on with us today, because feeding will be a need across the country that we are going to have to address in new and unique ways to meet these challenges. The medical system is overwhelmed, and if it's overwhelmed in New York City and Los Angeles and everywhere else, it will be massively overwhelmed in communities that have 2 to 4 ICU beds. So medical capacity will be required. And I think the unique challenge will be working very closely with jurisdictional authorities and community leaders to release things when they don't need them. One of the most positive pieces of news that's come across in the last few days was when Seattle and King County released 400 ventilators. They said, we're through our peak, or we think we are, and we want to see these be put to good use elsewhere. That the same has to go for volunteer resources. While volunteer resources may be free, holding them could be very costly to another community, and it's not something that we can afford as a movement. Some of these conversations may be a little more difficult with our governmental partners than we're used to, and we have to be willing to step up and have those conversations and make sure we're utilizing every resource as effectively as possible.
Thank you.
Thanks, Brad. I agree fully with David on this. I think that the resource adjudication piece is going to continue to be a challenge, and I think we can easily believe that as we reach some of these peaks and begin coming down the curve, that gets easier. It doesn't. We're going to go back up the curve again. I think that's what's going to happen, at least. I think that's going to, again, cause behavior. I think it's important to realize that I'm looking at things in 90-day chunks right now. Because if I can afford to let supplies go and give them to somebody who's got greater immediate need, the question is, can I get resupplied in the next 90 days so that we can respond during major hurricane season, right? So part of this is reeling. I don't need to hang on to it right now. We had N95s that we distributed through the FEMA regions to healthcare workers on the understanding that, we would have enough to get by if we had a major event in the next 90 days, and that we expect the supply chain to be able to resource us for when we get to August, September. But to hold on to that now while people are suffering these are hard decisions, but they're decisions I think we do have to take. I think this issue of needs assessment and understanding need going forward, as David said, I really think that's going to be critical, and I don't think it's all obvious or evident, and I do think it's going to be peak by peak, which I love the way you said that, David, and community by community. I think the feeding needs, certainly Patrick understands those and expresses them just superbly, and we're also grateful to Patrick talked about the support Red Cross provided to Feeding America. I'm very grateful to the support Feeding America has provided to the Red Cross, so that goes both ways, Patrick. But I think that we have this partner brief that we've been working together with a number of you on for the last couple of years. I think that VOAD sent the link out today. But as we go forward, I'd like to offer that we'll work with everyone and anyone if we can help identify need and display that data in a way that's useful, really useful. I don't want to waste time giving people a pretty picture to look at when there's nothing to do with it. But if we can action that and operationalize it and understand need together and act faster, and act in a coordinated way, I think there's a huge potential there. So we're certainly not just open to, but I think we're going to eagerly seek out the opportunity to look for ways where we can see need, display need, everyone else can see that need, and then there's a way to work together to best meet that need without duplicating and by being able to spread everything we have together where we have it. So we'll work with everybody on that piece of it. But I think information as a service is going to become critical in the coming days.
Catherine, also, we have Anthony on now if we want him to speak for a few minutes about SBDP.
Great. Thanks, Dennis. Yeah,
Great.
thank you for
Here
that.
you are. You hear me okay?
Yes, Anthony, please go ahead. We'd love to
Wonderful.
hear about St. Vincent de Paul's
Sure.
operations underneath
Sure.
COVID.
Oh, thank you. Sorry for being late. A little technical difficulties, but we were able to get it real-time action and get that rectified. St. Vincent de Paul is pretty much in a very unique situation. We have 3 active disaster case management programs that are ongoing, one in Puerto Rico, Texas, and in Florida. The DCMPs in Puerto Rico and in Texas are pretty much on the tail end where we're looking at pretty much at closing them. So there are some challenges. And we're just starting a program up. So and there are different challenges. So some of the challenges that we're seeing right now with the Puerto Rico and the Harvey programs is people working from home. They're using all of the technology, Zoom and FaceTime and Teams and what apps. And the main problem that we're having is with documentation. Even though we're able to create the documents virtually, sign the documents virtually, store them virtually onto our laptops, at every DCMP program that we've known, you've always had the hard file, and you need to get the documents and be able to get them and close the file. Also, you want to make certain that the clients that you've been able to work with have no unmet needs, their recovery plan is achieved, and things like that. So there's that whole process of how do we go about doing that? And I think we've pretty much have a good way of approaching that by using and working, using all the different technological tools that we have and working virtually. And we've been pretty much been able to go through the process, even make referrals, recommendations, and things like that. But the challenge that we're finding is you have that piece of paper, the document. How do you get that and put that into the hard file to close out the file? So that's on the back end when you're looking at closing. And looking at this technology, it really made me think about case management in a different light for the Michael program, where it's at the very beginning, and we're starting to say, if this is going to become a virtual type of program, so right now we're doing all the same. The intakes, we've taken all the intake documents, converted them to Word documents. So now all the DCMs can type that in, or if they have to send it to the client, have that completed. And we're doing all of the release informations, the verifying. We can do it via Zoom or free conference call, or the DCMs can have a third party in there. So all of these documentations, all of the things that we've done face-to-face, we can do in this manner. And, right now we're storing all of our documents locally onto hard drives, but I'm really thinking about at some point migrating all of these documents to some sort of a central repository, something like a Dropbox or maybe a SharePoint and things like that. We've also been very creative in terms of the CCAs. We know a cost construction analyst will go out and do a physical inspection while we're using all of this technology. I was with the military back in the 70s and 80s and did photo imagery at that time, which was top secret. We're looking at things now on Google Maps Pro, where we're able to see pictures, and we're able to determine, and the pictures are dated, so we can see pre-Michael, post-Michael, and some of our CCAs are even able to go out and do measurements, not only on the roofs, maybe, and perhaps on the side. Can't do anything on the interior. So getting some of these basic estimates allows us to complete some of the Xactimate applications and Xactimate reports that we have. And in addition, we've been working with all the long-term recovery groups that have also decided to go and become virtual. And we've been able to work with them, having these Zoom conference calls, and even working with our partners, American Red Cross and Salvation Army. And we're able to do a lot of those things that we used to do face-to-face now, doing virtually. So I think when we're in a very unique position where we have two programs that are kind of sunsetting, and we're looking at how are we going to do this case management going forward. So God forbid in the event we have something like this that happens again, we now are ready and we have multiple options of doing things.
Thank you, Anthony. I really appreciate that perspective, and just what we can do with technology is amazing. We have very little time, but there's a couple of questions that I would really like to get quick answers from. Is any of the screening protocol that you're using for volunteers available to the public somewhere? Would you be willing to share it with partners?
Yes, Brad, we're happy to share everything we have.
Okay, great.
And I mean, everything. There's nothing we're doing that we don't want to share, Catherine. So we can work that back through you with Mark Smith, but anything we're producing, it's really intended for everybody. And likewise, I would be very interested in the work of all of our partners. I think we've learned a lot today, so very interested to have that exchange.
Great, thank you so much. A couple of you all mentioned virtual deployments and how you're using your volunteers that way and volunteer leaders. Can you give some examples of what they're doing virtually and how you're doing that?
Yeah, Kevin here with Mennonite Disaster Service. They can be doing volunteer engagement. They could be doing writing letters of receipts, thanking donors, calling them up. I think the first stage for us was triage. We moved volunteers home safely. And then the second stage was more of an emotional thing, providing comfort and showing appreciation, making sure they stay safe. And so now, as we're in a maintenance phase, we can use them in other ways of social engagement, reaching out to their neighbors and pushing beyond even the realms of MDS, but reaching out locally to the local constituents.
Good, thank you. David, anything to add to that?
Yeah, I could add a few quick ones. The remote support opportunities that happen across the country could range from 211 call centers that need additional support. Team Rubicon After Disasters regularly staffs crisis cleanup call centers to support, and that can be done remotely. Emergency operations centers taking inbound calls can be done remotely. So there's all kinds of local engagement that can support the larger response effort that has helped. And then we've shifted many of our in-person trainings to cut the portions that we cannot achieve virtually, but still continue the elements that we can virtually achieve. So we have volunteer instructors still teaching courses across the country. And then I had mentioned volunteer leadership support, mentorship. Our planning process can be done largely remotely. So many of the tasks that may have been more convenient to do in person have shifted to remote.
Good, thank you.
Yeah, this is Anthony. Just to touch on that, the other part that we have with the St. Vincent de Paul is our national conferences and councils throughout the country, which are primarily made up of volunteers. And we've been, and they're all broken down to different regions. We've been implementing where we've been doing our weekly sit reps, but also providing webinars. In this way, we're keeping them abreast of the COVID-19 virus and things they need to watch out about, and how they can organize and be able to prepare different items, and also make preparations to help those people that are in need throughout the United States. So virtual has been a very big tool for us, and it's really very effective in this type of environment.
Thank you, Anthony. Well, there's so much to cover here. We could probably be here for days, but unfortunately we're out of time. Sorry for all the questions that we didn't get to. I do want to share quickly that from the poll at 43%, the single greatest challenge is adapting procedures and services. And I think today we heard some really great ideas, some creative approaches to how we continue to do our mission, but keep everyone safe and well. And that's the greatest challenge that we're facing right now. So I just encourage you to take what you learned today, do on it, test it, throw some ideas. Nothing is too strange or crazy right now to try. And the VOAD movement is strong. It's as strong as it ever has been, probably more online than it ever has been, but that continues to keep us operating. And I think one key takeaway from today is partnerships as well. There was an amazing daisy chain of how each person on the phone was supporting the other one, and I think that's how we also make this work. So thank you for all you do. Continue to stay healthy and be well, and if National VOAD can be of support, we would love to do so, and we will be releasing this webinar in the coming days with some other resources as well. So thank you all for joining today.
Thanks, Catherine. Thanks, Greg.
Thank you, and thank you to our panelists.
Thank you.
Thanks, Catherine. Be safe, guys.
Thank
Thanks.
you.
Everybody.